All right, ಧನ್ಯವಾದಗಳು. Thank you very much. This was about the institution Disables India Group, and this is also another video that you saw was of Disables India Learning Forum. 2018ರಿಂದ ಒಂದು ಕಲಿಕೆಯ ಮುಖ್ಯ ಉದ್ದೇಶವಾಗಿ ಇಟ್ಕೊಂಡಂಥ ಈ ಒಂದು ಕಲಿಕಾ ವೇದಿಕೆ ನಮಗೆ ಬಹಳಷ್ಟು ವಿಶೇಷ ಅತಿಥಿಗಳನ್ನು ಬರಮಾಡಿಕೊಳ್ಳೋದ್ರಲ್ಲಿ ಮತ್ತು ಅವರಿಂದ ಬಹಳಷ್ಟು ಮಾಹಿತಿಗಳನ್ನು ಕಲೆ ಹಾಕೋದ್ರಲ್ಲಿ ಯಶಸ್ವಿಯಾಗಿದೆ. ಇವತ್ತಿನ ಒಂದು ಸಂಜೆಯ ಕಾರ್ಯಕ್ರಮ ನಮ್ಮ 67ನೇ ಸೆಷನ್. Thank you, Dr. Achal, who have joined us today to share your experience and make this evening learning journey again. And thank you. So this group has been bringing in different dimensions of learning, and not just focused at any one particular topic as such. However, different people who have come and shared their experiences have given their perspective, and also that perspective has been well appreciated and taken across by varied audience who have been part of this group. ಹಾಗಾಗಿ ಕೇವಲ ಒಂದೇ ಒಂದು ವಿಷಯಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟಂತೆ ಅಥವಾ ಕೇವಲ ಒಂದೇ ಒಂದು ಸಂಸ್ಥೆ ಅಥವಾ ಯಾವುದೇ ಒಂದು ಸಮಾಜದ ಒಂದು ಅಂಗಕ್ಕೆ ಮೀಸಲಾಗಿ ಈ ಒಂದು ಸಂಸ್ಥೆಯ ಕಾರ್ಯಾಚರಣೆಗಳು ನಡೀತಾ ಇಲ್ಲ. ಹಾಗಾಗಿ ಪ್ರಾಣಿಗಳು ನಮ್ಮ ಜೀವನದಲ್ಲಿ ಹೇಗೆ ಬದಲಾವಣೆ ತರ್ಬೋದು, ಇನ್ಶೂರೆನ್ಸ್ ಇರ್ಬೋದು, ಹೆಲ್ತ್ ಇರ್ಬೋದು, ವೆರೈಟಿ ಟಾಪಿಕ್ಸ್ಗಳು ಬಂದಿದೆ. ಆದರೆ ಈ ಒಂದು ವರ್ಷ 2020 ಇಟ್ ಹ್ಯಾಸ್ ಬೀನ್ ವೆರಿ ಡಿಫರೆಂಟ್. ಸಿನ್ಸ್ ಮಾರ್ಚ್ ವಿ ಹ್ಯಾಡ್ ಅ ವೆರಿ ಕಾಮನ್ ವರ್ಡ್ ದಟ್ ಹ್ಯಾಸ್ ಬೀನ್ from a 1.5-year-old toddler to a 90-100-year-old ಸೆಂಚುರಿ ಬರ್ತಿರುವಂಥ ವಯಸ್ಕರೆಲ್ಲೂ ಕೂಡ ಮಾತಿಗೆ ಬರ್ತಾ ಇರೋಂಥ ಒಂದೇ ಒಂದು ಪದ ಅಂದರೆ ಅದು COVID-19. ಸೊ ಅದನ್ನ ಯಾರು ಹೇಗೆ ನೋಡ್ತಾ ಇದ್ದಾರೆ, ಅದರಿಂದ ಅದನ್ನ ಕ್ರೂರಿ ಅಂತಾರೆ, ಮಹಾಮಾರಿ ಅಂತ ಇದ್ದಾರೆ. ಸ್ವಲ್ಪ ಜನ ಅದರಿಂದ ಬಿಸ್ನೆಸ್ ಡೆವಲಪ್ ಆಯಿತು, ಅದು ನನಗೆ ತುಂಬ ಹೆಲ್ಪ್ ಮಾಡಿರಂತನೂ ಹೇಳ್ತಾ ಇದ್ದಾರೆ. ಬಟ್ ವಾಟ್ ಈಸ್ ಇಟ್ ಆಲ್ ಅಬೌಟ್? ಅಂಡ್ ಸಿನ್ಸ್ ಮಾರ್ಚ್ ದೆರ್ ಹ್ಯಾಸ್ ಬೀನ್ ಡಿಫ್ರೆಂಟ್ dimensions that we've been seeing of COVID, and how it's being looked at by a health professional, especially because it's not that easy from a public health professional's perspective. What is this corona all about? They have been the corona warriors for since the time this pandemic has broken out. ಫೀಲ್ಡ್ ಅಲ್ಲಿ ಇರುವಂತ ಏಕೈಕ ಮೇಜರ್ ನೇಮ್ಸ್ ಅಂತ ಹೇಳಬೇಕು, ಅಥವಾ ಪ್ಲೇಯರ್ಸ್ ಅಂತ ಹೇಳಬೇಕು ಅಂದ್ರೆ ಡಾಕ್ಟರ್ಗಳಿರ್ಬೋದು, ಅಥವಾ ಆಲ್ ಮೆಡಿಕಲ್ ಸ್ಟಾಫ್ and the police or all those people who have been continuously on the public service today, and few people who have restrained themselves to the house kind of situation. I will not come out. ಸ್ವಲ್ಪ ಜನ ಏನಾದರೂ ಆಗಲಿ ಪರವಾಗಿಲ್ಲ, ನಾನು ಬೀದಿಗೆ ಬರ್ತಂದ್ರೆ ನನ್ನ ಕೆಲಸ ನಾನು ಮಾಡ್ಕೊಂಡು ಹೋಗ್ತೀನಿ, ಯಾಕಂದರೆ ನನಗೆ ನನ್ನ ದೈನಂದಿನ ಜೀವನ ನಡಿಬೇಕು ಅನ್ನೋದು ಒಂದು ಚಾಲೆಂಜ್ ಇದೆ ಆ ಕಡೆ. ಸೊ ಇಷ್ಟೆಲ್ಲದರ ಮಧ್ಯೆ ಹೇಗೆ ಇದನ್ನು ಒಬ್ಬ ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಪ್ರೊಫೆಷನಲ್ ನೋಡ್ತಾರೆ ಅನ್ನೋದನ್ನ ಇವತ್ತು ಅಚಲ್ ಶೆಟ್ಟಿ will give us a perspective from his side of it. So Dr. Achal Shetty, who has been working as an assistant professor in the Department of Community Medicine, Father Muller Medical College, Mangaluru. Thank you for joining us this evening. And with his introduction, I think he's completed his MBBS in 2008, and also his MD in Community Medicine from in the year 2013. And he is also an MSc Psychology degree holder. So he's worked as a research officer in rural unit for Health and Social Affairs, Christian Medical College, Velluru, and also as a resident in the Department of Community Medicine at Sri Devaraj Aras Academy of Higher Education and Research, Kolara, Karnataka. And he has also worked on the research project related to the behavior change communication at the same institute between 2010 and 2013. He has successfully completed his postgraduate degree, that is Doctor of Medication in Community Medicine, from the same institute, the Sri Devaraj Aras Medical Academy for Higher Education and Research, Kolara. He holds a medical degree, MBBS, from Father Muller College, in which he completed in February 2008. He's also certified a course on Microsoft on logic and computational thinking in December 2018. So istondhu variety information itkondiddare. We will start to listen about his journey and his perspective about going without wasting more time. Thank you for joining us, and with all, welcome again to this forum, Dr. Achal Shetty. Over to you, and you have options to go over sharing your screen as well. Thank you.
Yeah. Thank you very much. First of all, before I even start, thank you for providing me this platform, and I would like to make the maximum utilization of this time, whatever has been given to me. Okay, so let me tell you that I mean, Shiv Prasad and myself, we both are friends since childhood. And the moment I started speaking about my work, he said, I think many people do not know how these things happen. And it would be nice if public gets to know about this and what happens in the background. Most of the people do not have access to this sort of information. So he said that it would be nice to share this. And as I have been working on this since past almost 6 months now, so yeah, I think it's a right time to let people know, what are the disadvantages, advantages of certain behaviors. Let me start. Okay, I'm going to share my screen now. I hope it's visible. It's visible.
Yeah.
Yes.
Okay, okay, okay. Fine. If you look at the title, it says COVID-19 as it happened. So, uh, what do I mean by happened? It's still happening, right? I mean, we have been constantly tormented by this particular term, and I'm telling I'm using the word happened. What I meant actually is that whatever has happened till now, it's still happening. I get it, but whatever has happened till now since we have come across this. And by the way, look, the subheading says a public health professional's perspective. In the sense, I would like to give my point of view. It doesn't mean that all of them have been based on strictly on scientific journals, because strictly speaking, we haven't even had that much time to do research on all of them. Okay, I have come across whatever I come across professionally, whatever I come across to the news source. Yes, I have included, and I have tried to make find as genuine information as possible. And yes, some of the scientific studies whichever has happened, I have included them. Okay, so yes, let's move on. Before I talk anything about COVID-19, and let's say related to transmission, whatever, it's a customary practice to tell one or two lines about an organism which has taken pretty much the whole world as a hostage. Okay? It deserves some mention, it deserves some definition as to what exactly is it. It is a virus. All said and done, it's just a virus, which is hardly, I mean, yeah, which is never seen to a human eye. And it is a virus which mainly affects respiratory system. As simple as that. Okay, it's a virus and it affects our respiratory system. Now, how does it cause all this chaos? Uh, there are different mechanisms by which a disease can spread. Okay, it can spread directly. It can. There are various mechanisms by which a disease can spread. But when it comes to COVID-19, the majority of the ways by which it spreads is through droplet infection. Okay, a droplet can be generated when you are speaking, when you are coughing, sneezing, all those activities. It will generate small, tiny water droplets from your mouth or from your nostrils, which will be let into the air. It will float in the air, and yes, eventually somebody who is closer to that person will catch hold of it. Okay, so now you know why we keep telling maintain a distance of 1 feet or 2 feet or whatever it is, it keeps changing. But yes, we tell them to maintain some distance because this droplet has got some limit as to how far it can travel. Okay, and just 2 days back they were telling that might be there is a chance that this is airborne. Airborne means that yes, it can take the help of air and it can travel very far distance. Currently, it's not confirmed. The main transmission method is through droplets. Okay, that is one. And yes, they usually use another terminology called fomites. Fomite simply means that if I touch a substance, a plastic substance or a steel or anything like that, and if you touch it in return, that is called a fomite. And yes, that's not that important. Mainly, it's the droplet infection. Okay. Now, let me give you in one single slide how far we have come. Okay, I'll give you a rough estimate as to what all has happened, what was the initial event. November 17th, 2019, okay, almost 10 months ago, we got first and the only case throughout the world. Okay, but the thing was, it was in a far, far away land, a land called China. And yeah, why should we be bothered if Chinese get one single case? And fast forward 2 months, we get our first case in Kerala in January 30th. By that time, Chinese had already registered 170 deaths. It had already caused some havoc in China, but yes, it was our first case. Okay, pass over 2 more months, we get our first death in Kalburgi, Karnataka, and you go still 6 more months ahead. That is, as of today, 3 p.m. We have registered. India has registered 93,440 deaths in a matter of 6 months. Okay, that is how far we have come from zero, almost what? Yeah, for almost 6 months back to 93,000 cases. So while this disaster was happening throughout the world, what did we do about it? How did we react? How does anybody react when there is a loss or an impending loss? You know, something is about to happen. How do you react to that? Or when you have just lost something, how do you react? The stages which I am going to show you, these are textbook material. Okay, and this goes something like this. First stage is your denial. Next is anger, third is bargaining, fourth is depression, and fifth is acceptance. These stages I'm going to explain in detail, and whatever you're going to see, majority of the presentation, today's presentation, I have tried to fit them into this particular sequence. Okay, of course we are not machines, there will be some variation here and there, but this is how a human being reacts to a major loss usually. All right, so let's start off with the first stage, that is denial. Denial literally means that you are not ready to accept something. Okay, and this is how we reacted. This is how our reaction was in the first stage. We said how they would not get affected much. I mean, how we are immune to these sort of viruses. I still remember post on Facebook. By the way, I haven't taken too many things from Facebook or WhatsApp because yeah, fake information, whatever. But I have tried to get some light-hearted comedy or whatever you call it. Okay, it was in Facebook, and there is a meme. It was using actor Yash, and the sentence goes something like this in Kannada. ಏನ್ ಮಗ ನಾವು ಚಿಕ್ಕಂದಿಂದ ಕ್ರಿಕೆಟ್ ಆಡಿ ಆ ಬಾಲ್ ಅನ್ನ ಗಟರಲ್ಲಿ ಬಿದ್ರು ಎತ್ಕೊಂಡ್ ಬಂದು ಅದ್ರಲ್ಲಿ ಆಡಿದೀವಿ, ನಮ್ಗೇನ್ ಈ ವೈರಸ್ ಆಗುತ್ತೆ. What it means is that how we have what we have immersed ourselves in germs, and how can any of these small viruses can affect us so much. That's what they wanted to tell. Yeah, I get that, but how has it turned out till now? Yeah, not so good, right? So this is one thing which we told to ourselves. Next, we told these are just conspiracy theories. Somebody is trying to harm us, or might be it was a Chinese bioterrorism launched against the US. Or there was one more theory which said that the only country, the only place which had first full 5G coverage was in Wuhan, China, and that's how we got it. Okay, and that's why India is not affected. It's not going to get affected so much. Or might be there is so much increased temperature in our country that the virus will die. It will not even come to us. These were some of the reasons, excuses, or whatever we told ourselves, thinking that we will not be affected. This is perfect denial. Okay, and what about the dead people? If you have observed, there have been so many celebrities, or at least well-known people, at least in the younger age group, they were dying out of heart attacks suddenly. There was sudden rise in the heart attacks among young people, and we have been thinking about this since the beginning, that there should be a system whereby you should test the dead even though they were not diagnosed to have COVID-19 infection initially. Okay, but there was so much resistance. In fact, when I had told it in my own place, I would not like to take names, one of the officials, senior officials in another institute said, we don't have enough test kits to perform on the people who are alive. How can we do it on dead people? Okay, and even to quote this particular report, Delhi said clear cut that do not test on dead people. Okay, these were the instructions given. And how will we know that whether we are losing these cases to coronavirus or not? Okay, if it is respiratory related, let's say somebody has died out of cough or breathing difficulties, yes, you can at least suspect There are certain scenarios where people die out of heart attack, stroke, a massive stroke, all those things. How can you attribute that to corona? Yes, it's difficult to connect the dots. I get that. But once we started getting reports of how exactly the things are going in the background, then it started making sense. Just 10 days back, there was a major article published which said that yeah, which said that the coronavirus affects the cardiac muscle, the muscle which is there in our heart gets affected in a major way, which we call like myocarditis. Okay, so this affects anybody, whether it's young, old, doesn't matter. Everybody gets affected by this. Okay, and that is how might be there were so many cases of cardiac arrest. Not only that, there have been instances where there were clogging of the blood vessels, clots we call that. Okay, thrombosis in the blood vessels. These things eventually can lead to death. And what do? We just close our eyes and we say that yes, these are not because of coronavirus. Might be there are other reasons involved behind this also. While somebody is already grieving a family member's death, they do not want to label them as death because of COVID-19. Might be they will have less number of people coming and helping them out. Yes, there are so many reasons why people would not want to get this done. Yes, we get that. Okay. Meanwhile, while all of this denial is happening, uh, the restrictions started coming into place. Restrictions, each country had its own policy. We had very at the very beginning, we had some international restrictions as to that regarding the travelers from certain countries. Let's say China or Italy, South Korea, we had some restrictions as to if they come over here, we would like to put them in quarantine for certain days. Yes, this is how it started initially, and we categorize these travelers as A, B, or C. A means somebody who is very symptomatic. B means not so symptomatic, but there is a high risk of getting coronavirus infection. Might be they have diabetes or some other disease. C means that they are asymptomatic. They do not have any symptoms, but they have come from a high risk country. It might be Italy or China or whatever. Okay, this is how the restrictions started falling into place. And then eventually we said everybody or anybody who comes from abroad, they need to be put in quarantine. We need to observe them. And the next one was clusters. There are certain groups which we suspected to harbor this virus, and we thought that if the people in this group were allowed to go out in the open, they might spread this disease. And some examples are this: Hazur Sahib, Nanded, and yeah, I think that is in Maharashtra, yes, and Tablighi Jamaat. Okay, so some examples where we started focusing on clusters, trying to restrict the spread of infection. Okay, while I'm talking about restriction, yes, now is the right time to talk about quarantine. QUARANTIN, the word which almost almost 90% of the population I think has heard for the first time, if not 90, at least 70%. Okay, this is the first time somebody is hearing this word. What does this mean? It simply means, as a summary, it simply means that we are trying to restrict that particular person's movement. That's all. Okay, we are trying to restrict that particular person's movement, and it's mainly for asymptomatic people. If somebody is not showing any symptoms or risk factors, yes, we would like to presume that might be this person is infected, but we do not know for sure. Let's wait and watch. Let's put them in quarantine and watch. That's how it is. Now, why would you want to do this? Simply because there are two reasons. One, you got to protect yourself and you got to protect others. If you show some negligence towards this disease, and start behaving normally or carelessly, you might put yourself at risk. And yes, of course, you would want to prevent the spread of infection. That is why quarantine was advised. Okay. Now, you might have also heard the term called isolation. Quarantine versus isolation. What does isolation mean now? It means that isolation is for those who are positive and symptomatic and or symptomatic. Okay, we want to strictly monitor these patients. There is no leeway over here. We want to put them in a particular room and completely restrict all the movements. Okay, that is, isolation is a stronger concept compared to quarantine, right? Now, these two things initially we were following for 28 days. If somebody, let's say, has come from abroad, they had to put themselves in quarantine for almost a month, 28 days. Okay, such a long time we used to do initially. And now, I mean, yeah, these things keep varying depending on which state government is doing this. No matter what central states, the health is a state issue. Okay, the state can take a call on this, but as of now, this is what is happening. If you have been exposed to a positive case, we would like you to put in quarantine, or we would like you to advise you to go into quarantine for 7 days. And yes, 7 days, seventh day, we would like to test you. And if you are positive, then 17 days of isolation. Okay, first 7 days, because I mean, first of all, why do you even wait for 7 days? Because it takes that much time. That's maximum time before we start seeing the virus in the bloodstream. Okay, and yes, you start generating the virus and it will be caught easily. Fine. Then if you're positive, then you have 17 days of isolation, right? Along with this, there are lockdowns, means the whole area is to get restricted movements. The whole area. The first example is in China. They started in January itself, and WHO declares COVID-19 as a pandemic on March 11th. Okay, almost 2 months later, they declare it as a pandemic. Pandemic is a bigger version of an epidemic. You all have heard epidemic, where there is increased number of cases of a particular disease, which is not at all expected for that time and year. If that happens on a global scale, massive scale, that's pandemic. Okay, so WHO declares COVID-19 as a pandemic. Now, India declares a lockdown on 24th March 2020. Okay, so almost about 2 months later, after China declaring its lockdown. Now, the concept of lockdown. Yeah, I know we all have hated it so much. I don't think there is even a single person who has really loved it. Even those people who like to stay at home, might be they felt that they are no longer unique. Okay? Anyways, each one has got their own reasons to hate the lockdowns. But why did we even do it? One thing, this I remember, way early in the course, group of microbiologists. Microbiologists are those who study the microorganisms like virus, bacteria. And they had written a letter to, I think, directly to PM Modi, telling that if we restrict the movements of people strictly, by the way, I would like you to focus on the word strictly. Strictly, if we restrict the movements for 2 to 3 weeks, we can make the virus not being able to transmit to others. Okay, I use the word starve to give you that special emphasis on that. But what I meant was, if we keep everybody at home for 2 to 3 weeks, might be the virus will not spread to others, and eventually the virus will die. Okay, within that person itself. So the might be the option of choosing lockdown was because we had another thing in mind, that just hide and wait, because usually an epidemic goes away. I mean, come on, this is not the first time an epidemic or a pandemic has happened. And if you are not taking examples from 1920, which is almost 100 years away, 100 years ago, yes, we haven't seen such a massive pandemic going on. Every time something comes, it eventually goes away. Okay, this is how an epidemic curve is. This is how cases progress. If you look at it, the horizontal bar graph, I have put the weeks, that is the duration, and the vertical graph is the number of cases. As and when the time progresses, let's say initially the number of cases rise. Within about week 5 or week 6, I mean, this is a random example, okay? So within that time, there will be a massive surge in the cases, and it will reach a peak point by about 5th or 6th week. And yes, eventually it starts going slowly down. Okay, this is how an epidemic usually starts and dies down. Okay, but if you, I mean, how did this even happen in the first place? Why does an epidemic die down by itself? For this, we have herd immunity. Okay, when something of an infection starts in a community, it's the herd immunity which comes to our rescue. And yes, I would like to do this. Okay. Okay. Here is your herd immunity. The left side is what happens initially, and then the right side happens. Okay, let's say this particular boy is infected first, and or the red ones are the infected ones, and the blue ones are the vulnerable. They can get infection, okay, but they haven't gotten it yet. So red ones are the ones who are already gotten it. Okay, so if there is no herd immunity, which happens when a disease starts, it's a new disease. Okay, it's a new disease. Nobody has been exposed to this disease, so nobody has got immunity. So the disease starts with this boy, then it comes to this boy, goes to this boy, it keeps spreading throughout the community. But when you come over here, okay, where let's say after 1 or 2 weeks or 3-4 weeks, what happens is those who have been mildly exposed or those who have been already treated and cured, they become immune. Okay, these green ones are the immune ones. So what happens, these sort of people start growing in the community. So eventually when even a case wants to give it to many people, it doesn't have that many people to give. Hardly 1 or 2 people will be remaining who are vulnerable. So this particular person is safe because of a barrier all around him. Okay, so that is how herd immunity works. It acts like a compound, a wall, right? And this is how we used to get rid of our epidemics. Okay, but that hasn't happened. That somehow this COVID-19 has been very reluctant, and it hasn't given rise to that strong immunity among people. Just look at the number of daily new cases. This is taken what, 3-4 days back, and we are still seeing so many new cases. It hasn't come down for sure. Yes, it has almost reached the flat level, that is plateau, but no, it hasn't come down to that extent. Okay, or at least overall globally. So you might ask yourself, was there any use of these lockdowns? Did we gain anything out of this? Okay, for that, yes. One thing which I would like to focus upon is capacity building. We did improve our capacity to handle this pandemic in a very, very good way. We did increase the number of beds allocated, the staff were trained. More than that, this happened called flattening the curve. You might have heard about this initially when they started the lockdown. They said flatten the curve, flatten the curve. This is what it means. Okay, just have a look at this diagram. In that, the white dots are cases other than COVID-19 cases, and the orange dots are the COVID-19 cases. And the whole bracket, you can see a square over there, the small squares and a big square. The entire big bracket is the number of beds in a hospital. Okay, now let's imagine we didn't do the lockdown. What would have happened is that more and more cases would have come to the hospital. Eventually, the hospital, before even treating the patient and sending them home, we would get some more cases. Okay, so within no time, our hospital beds would be filled up, and eventually the extra coronavirus cases, we wouldn't be able to admit them, so they would be in danger. And also, along with this, the usual diseases such as even a road traffic accident or even a fever or hypertension, in all those cases wouldn't have had beds to get admitted, and that is what would have led them to die. Okay, so we wanted to make sure that there is not immediate pressure on the existing infrastructure of health. So what we did a lockdown, and we tried to make sure that these cases started spreading over a period of time. Okay, this is what we call flattening of the curve. Okay, so now see the red dots are coming, they haven't started coming, but by the time the next red dot comes, the previous red dot would have been cured and sent home. That's why the beds were free. All right. Next stage. Okay, first one was denial. We tried to deny as much as possible. We started realizing that there is something going wrong. There is lockdown happening, a lot of restrictions to the movements. Yes, now we are getting angry. Angry at whom? God knows. Yeah, but mainly I would like to say that yeah, I did come across one video way initially where person from northeastern India had made a WhatsApp video, and he had used all the sorts of abusive words, telling that because of Chinese, his group has been targeted. you know, the Eastern Chinese look or appearance, we call it, where people have got certain appearance and people confuse them, all of those people, with the Chinese. Okay, so they were targeted, and he wasn't lying. There were reports more and more where people were abused, spat at, harassed. Okay? So yes, these things happened, and we somehow felt that showing our anger is productive than doing something about it. I mean, when you hate people more than the virus itself, yes, you start doing nonsensical stuff, right? So did it help anybody? I don't know. I can't think of any instance. Okay, so yes, but still the second stage happened, the anger started cropping up. Forget about these instances. Even if you ask somebody who has been admitted recently because of coronavirus, there will be some, I mean, there might be some anger issues as to regarding who has given them the infection. That particular person came to my house, he wasn't wearing a mask, he shook my hand even when I told not to shake my hand. Yes, here I am. Okay, so yes, anger is there, and it's natural to some extent. Meanwhile, while all of these angry processes are going on, government launched Arogya Setu app on April 2nd. Okay, this app is still there, and yeah, whoever hasn't downloaded or installed it, please do that. It's very useful for something called as contact tracing. And this is what I was talking about. What majority of our time was spent during the coronavirus pandemic till now. Contact tracing. Okay, what is it? What exactly is it? For this, you have to understand one smaller concept called period of infectivity. Simply means if I am infected with coronavirus or any, let's say, any disease organism, how long will I keep infecting others? Okay, so let's say this particular person has started developing symptoms today. Okay, so this disease, coronavirus, acts in such a way that by the time you start showing symptoms, it means that 2 days have already passed by since you have started spreading the germs. Okay, this has been a pain for us. You don't even know who is affected, who is carrying the disease, who is spreading the disease, because that person hasn't even started showing symptoms. And you are telling me that, okay, since past 2 days, you have been spreading the germs. Now, how do you, tackle this problem? There are so many diseases where the moment they start the disease, you will get to know them, you can put them in isolation whatsoever, but not so much in COVID-19. That has been a major, major issue in tackling the problem. Now, after you are showing the symptoms, from that day onwards, 7 more days, you will shed this particular virus. So altogether, somewhere 9 to 10 days. Okay, but we say somewhere near 17 days. We say if they are positive. Thing is, if you are symptomatic, it's better to have precautions. Even if there is mild cough or sneeze, chances are that small amount of virus might get dislodged into the air and you might infect others. That's the worry behind this. Okay, so this contact tracing, this is how it is. Let me show it properly. Okay, let's say the first person is positive over here, this person. Okay, this person has turned out to be positive. We inquire that person, and that person tells that 2 days before and till now I have come across this person, and this person. Okay, 3 people I have come across, and in a significant way, these, whatever you are seeing over here, these are all high risk contacts. I'll explain what high risk contacts are. For now, just understand that there was a significant contact between these people. Okay, so these are all the 3 of them were high risk contacts. So what do? We put them in quarantine, observe them for 7 days, and on 7th day, like I said, we test them. Okay, but when we tested, this person did not show positivity, this person did not show positivity, and only this person showed. That's why again in red. Okay, so now you have this person who is positive. Okay, you ask this particular woman, Did you come across somebody 2 days before started showing your symptoms? And she says, yes, I came across this person, I came across this person, and yes, I came across this person. Okay. And so we start observing these three people. And so eventually this person comes positive. So, and it moves on and on and on and on. Okay. This is how we do contact tracing. We see wherever there is significant contact, we observe them. If somebody is positive, then we ask them whom they came across. I hope this was not confusing or fast. Okay. Now, this is how we assessed the severity of the contact. I told you, was it a significant contact? How would we know? This is how we know about it. I mean, different people might have different ways of categorizing it, but this was widely followed, especially in the medical college. There are 4 different types of no, categories. We would like to find out how much is the distance. That's why we keep telling stay far away, stay far away. This is what it is. It matters so much. I told you the droplets can get easily carried over to the next person if they are standing close by, less than 1 meter or more than 1 to 5 meter. Okay, so that's the first thing. Second thing, the patient, whoever has come positive, whether that patient was symptomatic or asymptomatic. Did they start showing cough, fever, body ache, things like that, or symptomatic? Next step, what we would like to look at is whether you both were wearing mask or not, the patient themselves and you, okay, contact. And the last point to find out is your duration of contact. How long were you with that particular positive case? Okay, so let me give you an example. If I have met with a friend who turned out to be positive, I would have been less than 1 meter because he's a close friend, and that person might be symptomatic. He was coughing occasionally, and as we had grabbed a coffee, both of us were not wearing mask. Okay, and all it needs is more than 5 minutes of contact, and I'm already a high risk contact. Okay, so I need to get tested. All right, so that is how we assess the severity, and we test them and follow them. Okay. Next, I was talking about Arogya Setu app. It was a really good move. I think we were one of the very initial countries who had rolled this out, and that too officially. The key features were you have to register and you had to put in whether you have signs or symptoms, whether you have gotten tested, all of these things. And it will ask you that you should switch on your Bluetooth and global positioning satellite system, that's GPS. With this, it will keep a track of wherever you have gone. And eventually, if you get tested positive, you will have to go over there and label it as positive again in the app. The moment you do it as positive, it will start notifying those people who had come across you 48 hours before that. For the past 48 hours, whoever has come across you, they will be notified. And how did it come to know? Because the other person also would have switched on their GPS and Bluetooth. So it knows where everybody is roaming, and eventually it will figure out that did you come across these people, they'll notify. Such a brilliant move and such a bold move. Yeah, it was very good. You don't have to break open your head manually. It would do it automatically. Yes, that is good. But there were some objections to it also. Why bad? Such a important step. Why would we call it bad? Of course, it's because of privacy. Okay. I mean, are we all comfortable with government knowing where we have been every day since past 6 months? Yeah, might not be everybody. Okay, so that is why it was criticized by some. But is it done elsewhere? Of course. I told you we were the initial ones, but we were not the first ones. How do you think South Korea or even China started eliminating this problem so fast? Because they took the privacy and they threw it out of window. Okay, privacy was given no chance over there. Even a country like South Korea, they had employed strict measures as to find out where people are moving. Is it done everywhere? No, not yet. I mean, imagine, even if companies like Google and Apple have gotten together and still they rolled out a particular system by which you can track, it hasn't been implemented everywhere, even in US. Imagine, okay? And hardly a few countries have taken it completely. That is how much it is facing the difficulty. But yeah, it's a good app, all said and done. We are done with the initial denial, anger. Yes. Now we move on to the third stage, that is bargaining. Bargaining, you start realizing that you cannot escape completely. So you start telling, okay, fine, let me do something. And might be this will be okay. I will do a compromise in my lifestyle. And might be I will be okay. I can still escape out of this provided I do this. Okay, you are basically trying to compromise with nature over here. And what happened, the good way of doing a compromise, which many of us are doing actually, is making the best of situation. Okay, where we say that virus will be there, but we will try to build our immunity. Might be by doing this we can escape the situation. Yes, this is one good way of doing a bargain. There is a bad way of doing a bargain too, having unreasonable faith in non-tested remedies. I mean, I need not tell how unreasonable people can get. I mean, if you can sing a song to coronavirus to make it go away, go corona or whatever it is. Yeah. Okay. So the point is, there are people who have done really, really nonsensical moves. But yeah, I'm not criticizing so much because we are all humans at the end of the day. There have been too much of panic and something will be done as a result of that. But yeah, what about the new ones? There are some measures which we can take. Let's say hydroxychloroquine. But mind you, this hydroxychloroquine was recommended. I mean, in fact, even a study was published on 1st June by ICMR, telling that it's a good option where you can prevent the infection. Mind you, this is not a treatment. This is for prophylaxis, that is prevention of treatment. So prevention of coronavirus infection. It still continues to recommend for healthcare workers. Mind you, it is mainly for healthcare workers. And there were so many precautions given along with that. It was told that if you have some sort of abnormality in the heart, you will have to not take this medication. You will have to take a ECG beforehand before taking this medication. But no, people were already on the edge of it, and they were getting it by hook or crook, getting it from medicine stores, wherever, and taking it left and right. There was so much danger involved in that, and some of the medical workers themselves were affected severely, and they had to be admitted in ICU because of cardiac complications. Okay, so yes, this is what we do when we want to get out of danger. And there are some things which were outright dangerous. That is swallowing the sanitizer itself. Between May to August, CDC Atlanta, the Center for Disease Classification, Atlanta says that at least 4 people have died. I mean, this is just death. There are so many people who were admitted in intensive care because they did swallow sanitizer. Might be because some president told it or somebody else whom they followed told it, whatever it is. Okay, it's such a dangerous thing. And what about traditional remedies? There have been reports, I do not want to take the name, there have been reports recently that well-known traditional remedy person has been given permission to supply these drugs. What about them? We do not know. We do not know for sure as of now. Okay, only time will tell. What I this is my personal view, is that whenever a drug company wants to bring out a new drug, it is the particular drug is tested for on so many people. Okay, not just 10 or 20, on so many people, and then they recommend that. Yes, of course, we do not have that much time with us, and that's why I think yeah, it was allowed. Anyways, time will tell. So that was about the bargaining. Now the next stage, the fourth stage, depression. After denial, anger, bargaining, you have depression. This is a stage where you start realizing that something is wrong and there is no escape from it. Okay, eventually it will get to us because we are being bombarded by various stressful situations. And the calls and text to mental health hotlines were spiking so much. And yes, there have been some measures taken towards it. So many different helplines were opened up because it was realized that people need support, somebody to listen to their stress. And the CDC reports that even in US, among adults, within about 3 months, the anxiety rates tripled and the depression quadrupled. 4 times the prevalence of depression had happened. And that too, US was a country where they didn't even have that stricter levels of isolation or lockdown like in India, and still the rates were so high. And I have quoted US because we haven't got that robust data yet from our country. Okay, so what is this depression because of? I mean, why is it happening? Is it because the coronavirus itself goes to our brains and does something, or is it because of stigmatization? Stigmatization or stigma, what is it? It means that you are discriminating somebody, or you are treating somebody as unworthy of your personal contact. In Hindi, you might say chuachut or untouchables, such situations where you're trying to keep a particular person away. Yes, of course, you are doing it because of reasons of fear of getting infection, but stand in that person's shoe and then think about how you would feel. Till yesterday, all those people who were praising you or wanting to spend time with you, all of a sudden they are pushing you away. Yes, it's a bad feeling, of course. Okay, this is way early in the course where an Andhra Pradesh man ends his life. He even chased the people who was trying to come to him, his own family members, and eventually he ended his life because he suspected that his fever was because of coronavirus. Such is the pressure being put upon people if they come to know that they are going to get coronavirus. Okay, that is the level of, and he worried about the stigma, how people would treat him. I had my own personal experience way early, some in April or something, because of miscommunication and wrong classification. I was termed as high risk contact, and I was told that I need to be quarantined. Okay, now I know for sure that I need not be quarantined because I have been doing this for so long. And but anyways, the order was passed that I need to be in quarantine. Okay, and I wasn't even sure whether I should tell my neighbors. The neighbors wanted to approach me, and I said no, stay away. And thus it started. The questions were asked. I felt bad that they are inquiring me because they want to chuck me out of the apartment or something like that. This is how it starts. I mean, everybody is human. Yes, and stigma does affect people. And eventually, I had to challenge it, get myself tested, prove that I am negative, and yes, I did come out of it, thankfully. Okay, is the depression because of burnout? I mean, I think more than anybody else, on August 10th, I mean, more than anybody else, I think there are a couple of professions which will be swearing by this reality. On August 10th, among doctors, we found out that I think two of them had committed suicide in AIIMS itself. Okay, because of so much of excess overload in their working scenario. And August 19, a doctor in Karnataka commits suicide after fighting as a corona warrior. After fighting for so long, even a minor trigger can push somebody to commit suicide. That is the level of stress people are going through in some places. Not only this, I think this all the tech friends of mine, anybody who works in tech industry will be able to say that the work from home moment, oh God, it is, I don't know what do you call it. It was initially, it's a blessing in disguise, but no, it's not that. Because according to me, there is no blurring of the work and the personal life. You work from home and you work at home as long as possible. So Microsoft found out just, I mean, this is recent, some 3 days back, they said that 1/3 of the global workforce is suffering from burnout. Okay, and guess what? They have a solution for that even through a software. For teams, they're developing a facility called virtual commute, where they realize that the moment you stop your work, you should not be pushed directly into the family related work, right? There used to be a usually work, especially Bangaloreans will know how much time it will take to go home, and you could at least listen to some songs or look at some people. No, that is not happening, right? So Microsoft said, Fine, we will do that virtually. When you're about to finish your work, start this virtual commute. It will start winding your work. You can key in whatever you have done for that day, and eventually you'll be told, yes, you have logged off. I mean, yes, these are the things which are coming out now. Okay, burnout is a reality, at least in so many professions, if not all. Third reason is because of economic reason. Of course. I mean, so many people got affected by that, and even in tech sector, 10,000 people have already, lost their jobs. And I do not even want to think about the entertainment industry, book my show or whatever, and the travel industry, travel and hospitality. So many people are affected. Of course, there is a major pinch when it comes to economy. Okay, and this was a major paradox which was faced not by us, thankfully, but in many places the salary was cut for doctors, but in so many other places it was told that in whatever happens the salary should not be cut while they could sit at home. And it was such a demotivating factor for so many people who were putting their lives at risk and their salary being cut at the same time while others were waiting for. Okay. Yeah. Is it because of isolation that you were told to stay in the home for so long? Of course. We are social beings. We do want to get connected no matter where we are. And after getting locked down for almost what, a month or something, our PM Modi said, go and show the appreciation to all the workers. Yeah, and yes, this is what we do. We went on the streets, we went in the lines, and we still showed our appreciation, staying so close without mask or whatever. Isolation does that to people, and yeah, it can put us in depression. Or is it because of adjustment disorders? Imagine putting with somebody whom you do not want to stay with, or you at least you thought you could stay with, and now you realize that you cannot. Divorces happened. In China, it was the first one to report, I guess, where the moment the lockdown started, coming out, yes, divorces skyrocketed over there. Not only China, even in Japan, UK, the rates were rising. All of a sudden, the couples are realizing that no, they're not meant for each other after spending so much time with each other. No, they're not tolerable. Yeah, might be this is because of that. Or is it just a phase in the process of accepting reality? You have realized that corona is not going to go away. Eventually, it might affect us in some way or the other. It might be amalgamation of all of these. The last stage is acceptance, where we have realized that there is no way we can escape this thing, and yes, we got to accept it. Okay, we have to live with it. This is the terminology or this sentence which we keep hearing now and then. But you have to understand that I have used the word live in red. I'll tell you why. More than that, I'll have to also tell that helplessness in the fight for survival has pushed us, to go back into the out world and start earning a livelihood, because we cannot stay in for long. Okay, we have accepted the reality. We need to get back to work, or else we are gonna get some of the other type of difficulties. And the reason why I have put that live in red is because understand that we have to live, in the sense we have to live for long. If acceptance means that negligence, we are horribly wrong. Okay, acceptance means that we just acknowledge the fact that it's there. It doesn't mean that we have to stop doing whatever careful practices we were following. Look at this. I mean, not just this person. There's so many people who would wear a mask like this. Again, I think one more reason is that some people bought mask in March and now the elastic has gone weak and they're thinking twice before buying another. They might be feeling that the corona might pass away soon and why buy one more mask? Might be. But this is not the way to go forward. Okay, and not only this no mask, there are situations where people have almost forgotten what we have been going through. Mass gatherings. Okay, mass gatherings. I think this is some 2 months back, so 2 to 3 months, like somewhere in May or June, it had happened, and this went on giving rise to outbreaks. Some other outbreaks were happening, and yes. Now, who is to be blamed for this? Now, why did we become so careless all of a sudden? Huh? Is it the mass media? Think about it. I mean, at least I remember it properly. The first death, when it happened in Kalburgi, I had called my parents and I was talking to my mother, and she seemed a little bit anxious, and I was already sensing panic in pretty much many places that Corona has come and it has caused a death. And that time I was watching this TV channel, and one of the news channels had already telling things like killer Corona, and they were trying their best to instill fear. I mean, yes, this is how the TRPs might be improved, but imagine what happens if you keep telling somebody that you're going to die today, you're going to die today, you're going to die today or tomorrow. Eventually, you would say, okay, fine, let me see what's going to happen. Desensitization. You keep getting pricked in one single place, eventually, you might start getting numb over that. Okay, so that might have been what has happened over here. So, if you look at what has happened till now, all the 5 stages from 0, 1, 2, 3, 4, the denial, bargain, all the anger, all those things. Okay, this happened in the community as a whole. I told you, but there is a very interesting phenomena which happens when it reaches your personal level. When somebody starts experiencing these symptoms on a personal level, if it starts coming to you or me or anybody, now what can happen? Again, the same stages can be seen in a very, very evident way. Okay, the same stages, denial, anger, everything happens, and I would not like to repeat all of them except for denial. Okay, denial, these are the usual strategies followed by some people. Don't even get the test done. I mean, there's a saying in English, ignorance is bliss. I mean, if you don't even know that you are corona positive, you can stay happy, right? I wish they were right. Or there's one more strategy where you get all the tests done except COVID-19 test. You will get your malaria test because there is fever, there is dengue, there are people who even get liver test done. Okay, I don't know why, but anyways, at the end they will not get the COVID-19 test done. Okay, because once it is known, then yes, you have got your own set of difficulties. Okay, we get that. Then there is another way of denying it. Try to misattribute symptoms. If there is a symptom, let's say there is cough, okay, or fever. This is rainy season, and eventually people do get fever, right? And it might not be. It might not be coronavirus. There is one. Or even if there is typical symptom of loss of taste, there will be there might have been bad food and I have lost taste recently. I don't know what is cooked at my home. I don't like the food at all. Or if there's loss of smell, I have sinus problems. There are so many reasons. And the last one is it is just a virus. I mean, of course, it's a virus. It's a coronavirus, and it hasn't gone away this time. Usually, a virus takes its own course and goes away, but it is not just a virus this time. Okay, and we also do bargain with this, where we say, how about I do not get tested and I go myself into a quarantine voluntarily? Whatever duration you are telling me, what if I put myself in that for these many days? Okay, will you be really vigilant? Will you be totally careful as to whatever symptoms happen to you? Will you be looking at yourself so carefully? Will you monitor your symptoms? Fine, one point. Next, what if the complications have already set in? There are scenarios where people will not realize it until the last moment, and all of a sudden the complication starts. If somebody is having a symptom, let's say fever, cough, something like that, might be the process has already set in. Okay, it's better to find out these complications early by getting some test done. Only when you get COVID-19 test positive result, doctor would advise you certain tests, like let's say X-ray, or there is something called as cytokine related test and all those things. Okay, by this we will know if there are complications happening, especially in the elderly. What if you are harm to the society? You can't tell others that you are COVID-19 positive. What if somebody else comes to you, or you go outside because you do not even know for sure whether you're COVID-19 positive or not? Okay, these are the things you will have to keep in mind if you are going for voluntary quarantine without getting tested, by the way. Okay, now who is to be blamed for this? Why there is so much reluctance to go to the hospital? What happened? Is it the medical fraternity who has given rise to this sort of loss of hope among people? I mean, this is what many people have told me. It's like everybody who gets tested nowadays turns out to be positive. I mean, of course, the numbers are so high. We are getting some in the 90 to 93,000 positive cases, even when people are not getting it tested. That means there are so many positives in the field. It doesn't mean that they are turning out to be positive just on purpose. And then even if there is no admission, once you are positive, my 17 days of livelihood is lost. What should I do for the, my daily bread? Yes, this is what is told, and this is what people are thinking. But yeah, think about how much of a damage it can do to your health. Or is it because of less faith in doctors themselves? High treatment cost. I mean, the moment you go in, they'll charge you lakhs and lakhs. Less care. They don't even come and see you. They hardly give you something, and they make you wait for days together. Or the whole thing is a conspiracy just to make a profit. There is so much money involved in this. Of course, you would tell that they are positive and get them admitted. Okay, let's consider what doctors say for this. Doctors' defense is that for high treatment cost, this disease has taken a costlier approach. I mean, it's not a disease. So many things which goes over here. There is plasma therapy, there is PPE kits. So many people have to wear PPE kits for this. And yes, the antivirals. When was the last time you took antiviral for a common cold? This is happening over here. Okay, then there is less care. For less care, they say it's a new disease, new strategies. For example, there are some people who wouldn't even require a strict monitoring of drugs. There will be some drugs which will be given for boosting of immunity, but mainly it will be for observation for complications. Along with this, yes, there are newer strategies where we cannot afford to keep looking at the patients, because every time somebody has to wear the PPE, go over there, and yes, it has to be changed. Okay, imagine. And over that, the staff themselves are working in shifts. One person has to take care of patients for so long, and then the next person comes. So what I'm saying is, it is not the same as the previous diseases. The strategies have changed. Okay, and the profit-making approach. If you are thinking that all the doctors are making profit, not all doctors. Okay, because if you are getting this treatment, usually it's in hospitals, and hospitals will have so many doctors. Might be the ones who are managing in the top level, I don't know, but the ones who are working at the low level, they are already having burnouts. They're having stress-related disorders. They're trying to commit suicide because the workload is so high. They want to treat the patients and not make money out of it. I mean, not all of them. Okay, so have faith, but why have faith? That's the question. What's the advantage? Why should I have faith in doctors? I can take care of myself. Okay, make sure that you don't give excuses and there's complications, especially those because there are no invulnerables. Everybody is vulnerable. Whether you are young, old, you're athlete, doesn't matter. Okay, you will stop giving excuses, and yes, thus you can avoid complications if you have faith. And this thing, let's say you have corona positive and you haven't gotten yourself tested. There is something called as happy hypoxia, where whatever you breathe, the oxygen doesn't reach the blood. Okay, eventually you will start developing the shortness of breath. You will feel difficulty in breathing, but by that time the complications have already gone to the next stage. Okay, so this is what we call happy hypoxia, where you are not realizing till the last moment or complicated stage. If it was in the usual scenario, the moment you don't get oxygen, you will start developing shortness of breath and you will get yourself tested, but that is not happening. Okay, so can you be vigilant about it? Can you take self-care? Okay, fine, buy a pulse oximeter. Usually it's better if you buy FDA approved or at least some certified device. Yes, something will be monitoring your oxygen levels. That can be fun. And make sure that you buy lots of batteries, because if it is going low, you will be given wrong values and you might panic. Okay, and there are insurance schemes also, even by government, Ayushman Bharat or other commercial ones. And also even if they reach the cap, there are floaters called Corona Kavach, where let's say I have a cap of 5 lakh rupees, and if I go into ventilator, my expense is going to increase. And this is where Corona Kavach comes into picture, where they will start providing extra funding depending on how much you are invested on that. Okay, so and I think there is not even an age limit in this Corona Kavach. Just yeah, you will have to look into it. So outcomes are not uniformly bad also. Do not panic. Go to hospital as much as possible if you have symptoms. Just there are so many cases who have recovered from them in 20 days, a 100-year-old man, or 5 days, a 110-year-old woman. They all have recovered. I mean, many people have recovered. Okay, you need not panic so much about it. Okay, fine. Now we are done with all the stages. Let me give you a nutshell some current stages and what we are going to do for the future. Globally, we are in second in total cases and third in total deaths. Okay, behind US and Brazil, we are the third in total number of deaths. So what should we do? Go back to lockdown? Lockdown would have been protective uh, as long as it is productive. In the sense, if we stay any longer, might be our livelihood will be at stake, and we do not have much choice in this particular aspect. We cannot go to the strict lockdown like before. Okay, should we be fearful? Uh, to some extent, fear is beneficial. It will help you be careful. You will take some measures. Okay, and fear is ingrained in our evolution. It will protect us. There's a reason why we develop fear. But if you are not careful, a fear can cripple you also. It can make you so anxious. Yes, who knows? You might have a nervous breakdown or something. So yes, fear little bit is okay. Do not you know hate fear so much. What about vaccines? This is what I wanted to talk. Just there are 4 phases in development of vaccine, and understand that it usually takes a decade to develop. It's not that easy to develop a vaccine. Okay, and on March 16th only we started the first coronavirus vaccine testing, and it's been just 6 months now. And what do we expect? Just look at this graph. What takes a decade? There has been certain scenarios where we wanted to fast track it and try to bring it out as fast as possible. SARS 20 months, Ebola 7 months, Zika 5 to 6 months. And we were expecting COVID-19 to have a record breaking approach and we would come out early, but no, till now it hasn't come out. And mind you, we have even tried to cut the corners. We tried to skip certain stages. I told you there are 4 stages, right? And one of the initial stages is testing on animals. We didn't even want to test on animals. We wanted to skip those stages. And is it a good idea uh, of getting a vaccine somehow by cutting all the corners because we don't have time? Not that good an idea. What if there are side effects? That is why which had led to the stoppage of Oxford vaccine recently. They are restarted, but if you are too hasty about this, if you are going too fast, might be there will be so many side effects which can be detrimental for people. Okay, that's why we cannot go that fast also. So currently hopeful candidates is AstraZeneca by Oxford. It is 1,000 rupees per dose when it will be available, and there will be 2 doses given. It will be made available to India, thankfully, because we have collaborated with them. Currently it's in stage 2. And Serum Institute Pune, currently in stage 2, it's our own vaccine. And Sputnik Russia, which you have been hearing recently, it is about to start trials in India, but it's already available in Russia. They have cut some corners. We do not know how safe. Yeah, hopefully it will be safe. Okay. Remember, earliest it will be available by late 2020 or early 2021, not before that. And it will be provided on a priority basis. Whoever is in dire need of it, might be frontline workers like doctors or police, they will be given first, and then eventually to others. Okay. Efficacy, how effective it is, we don't know, because like I said, the immunity is not that strong even among those who are infected. We do not know how strong these vaccines will be. We'll have to wait and see. So what to do if not vaccine also? Just wait and watch. Just look at this particular diagram. First place is ours, sorry, second place is ours, and the list, and third is Brazil. And just look at Bangladesh. Bangladesh new deaths, the red column at the end, they have 28 deaths per day, and we have 1,144. If you keep looking at it, there are certain countries where the cases have come to zero. Okay, many countries throughout the world are reaching the end of it, but we are still soaring at second or third position. It's a bad scenario. We'll have to wait and watch. Nothing more we can do as of now. But understand that India also has got highest recovery rates, 80%. That's the highest. Okay, a lot many people do get affected, but they come out of it also. Along with this, there are rays of hope. Humanity is still there. We are still here. 15,000 homeless people, and they were provided food through Delhi government. And yes, there are so many instances like this where people were helped. You know, even during isolation, how do you think people are able to sustain in their isolation? Because there are people who can help them out. There are people volunteering to give them food or goods when they are in a quarantine in their houses. Even in hospitals, there are people who can help them. Even stray dogs, initially when there were no food available, the dogs used to there are so many reports of dogs biting others, and people took care of dogs. And yes, that is how humans are. We do have the humanity left in us. Okay, this is what was told to us: united we fall, divided we stand. Look at what is happening right now. Aren't we united even through virtually? I am taking this session from my home, and we all are watching from our own homes. This thing hasn't stopped us from connecting with each other. We are united no matter what. Okay, and yeah, even this shall pass. But remember that something else might arrive also. Yeah, this shall pass. Something else can come. Just to give an example, brucellosis is already there in China. They say that it is making men sterile. People will not be able to have children apparently with this attack. Yeah, there are corona. There is corona part 2, might be this corona part 2, things like this. But all said and done, at the end of the day, you have to remember that we are still here, okay, and we are still fighting. That's it. Okay, yeah, that's it. Any questions?
Thank you, Achal, Dr. Achal. It was so continuous, didn't feel like stopping you in between. And it's like the statement from Major Bhagava does mention the same. I mean, it came out so well, smooth and fluent, and it was so well narrated, and the flow of slides did make a lot of impact and a lot of knowledge sharing. We'll wait for a few questions to start with. Yeah, we have Sunil raising his hand. Sunil, you can unmute your line and start with the first question. Please go ahead. You can unmute your line.
Yeah, see, it was a very nice presentation, Mr. Achal Shetty. I think you've taken through, it's like a movie which has gone through for the last 6-7 months. And I am also one of the victim of COVID, and I've recovered out of it, and the entire family has recovered out of it. Of course, we had a terrible time because it happened to us in the month of June. In fact, I wanted to share with most of you because that is a time where the awareness was very low, and we went into a lot of panic stage, and putting posters and people looking at you, and people taking photographs when the barricades were open. And it's a terrible time because dad was in critical stage. He was in ICU, and we were at home. I mean, we were in the hospital, and my wife was at home. It was a terrible time. We actually went through it. But I still I don't understand why, of course, lockdown is now becoming an impossible solution. But still, why are the government allowing the senior citizens to step out? Okay, why not a lockdown for the senior citizens? Because we know very well the biggest impact is going to the people with diabetic and with other illnesses like heart alignment and cancer patients and asthma patients. And it is a very simple step just to ensure that, okay, 60 plus not to step out, okay, and lock them out. That is one thing. And the media should be more on educating, because this is now, it has become a social outbreak. Now media should rather telling us the update on what is happening around. They should be telling about how to respond to the situation in our at home. Somebody gets COVID, and how do we protect themselves, or somebody because nobody is aware of it. Because to tell you frankly, now post my recovery, I am dealing with almost 25 people, okay, who are in regular touch with me, whom I am talking. Of course, I cannot recommend the medication, but I am working on the precautions, whether the testing, and because when they get positive test, okay, at least acting as a counseling to them, telling them that, okay, what are the positive side of it, and at the same time, what is oximeter, how to monitor it. These are the things, and really do not understand still people talking about the tallies, number of cases. That is not going to help us now. The scenario is that now we need to, the entire media should get into it. What is that? Because at least the doctors to talk about it in the media in terms of what is the precaution. Of course, we are talking about mask and sanitizing, but apart from that, now we need to talk about, because getting positive cases are increasing now. And now every family has at least one member or in the relatives that they have cases to find now. So this is the time where now we have to talk about, yeah, post positive, what you need to work, rather than now pre-positive precautions. Now we have to work on post-positive inclination. So that is what is my view is concerned. Achal, any comments from your side?
The thing is, when we start, let's say, categorizing people as elderly and telling them not to go out, uh, I wish every elderly in this country were taken care of so well by their offsprings. It's not that easy. I mean, even the elderly have to take care of themselves, right? One thing, and second thing, when everybody else is going out, I would think that the people who are staying in the home, even if the elderly are taken care of by somebody else, even if they are taken care of very well, if this particular person goes out and catches infection, it doesn't solve the purpose. I mean, it would be a good measure, but there is so much to lose. We have lost so much. It's a tough move. It's a tough move.
The situation is now until next 3 months, which is very, very critical at this stage of till December. And we know the medication is available only post that. Of course, the senior citizen, if you look into it today, fortunately in India, we have only around 10 to 15% is the senior citizens ratio. I'm talking 60 plus, because 70% of the population is between 0 to 35. That is a demographic. Now, since we have a limited, unlike other countries where the senior citizens are very high, and so if we can track them, or even because today we have so many diabetic doctors, they know who are the clients very, very well. So, and the connecting the other cards over somebody who needs that food supplies for them, so to be arranged, because rather than blocking the entire country, so now if we can address the 10 to 15% of the senior citizen, so giving that needful support, probably it will come down, because the majorly death rates, what we are seeing is only people with other issues, other complications. And of course, the younger population with fear and panic scenario. That is one view. The other side is that why still there's no media communications on
Well,
post.
media would, I believe I can interrupt here.
Please.
More like, I mean, they would make you read or get to hear only what they want to share, and not what you want or what you like to hear. It's
Yeah.
more of a situation, because if you have seen the focus that has been shifting in the last few days, yeah, the count of deaths has taken a back seat, and the cases against the new celebrities being highlighted for the CCB interviews are more. So let's keep it away from that side of it. But yes, I mean, like you mentioned, yes, I believe Dr. Achal would also very well agree. There needs to be more update on it. I mean, RCB versus CSK would be the more talk of the town in the days to come, before we go to the next discussion as well. So, I mean, media has a different role that they play, because even they have been continuously bothering or been focusing on one particular target. So, okay, Dr. Ashal, I'll leave it to you to answer it that way.
Uh, shall I add one point to that?
Yeah, please go ahead.
The thing is, this is my personal opinion. When news is being given and information is being given, why is there a need to put a background music? I will never know. Okay, this is what we distinguish
Sensationalizing.
as manipulation and what health information. You are manipulating people just by putting some background information. Why do you need to show horrible pictures in the background just to scare people? Your job is to give information, and that's all we want. That's all. That's my conclusion.
Very true. Right. Any other question, or Sunil, if you have anything further? So
No, I was just, it's a debate, I mean, discussion I was just wanted to have, because somewhere I not able to digest this. So that's why I thought, because The reason is being affected, and now
Well,
I see, because a lot many people whom I still get positive cases in right from my office, because I was the first one in my office to get this red flag. And now the entire system works around me. I've become a call center now for everybody to treat on.
well, I think
So,
it also goes about the way that you have proved yourself to be of concern, and your experience would be the right way of sharing it. Maybe you pairing up with doctors and then giving other people a ray of hope. Yeah, like he mentioned. Yeah, should there be fear or should there be more better communication? Could be the right way of looking at it. Even I have been on the field like a more of a volunteer sometime, and we
yeah,
always see that yes, our request was of other people not to come out, and we will help you out so that at least we'll have limited people on streets when we
right.
started off being volunteers on the road. So the intention was to ensure that if there is a medicine required, yeah, we will drive to your home and hand over the medicine, but do not venture out. That kind of a thing did happen, but yeah, it's now you cannot be held on to a uh, place for such a long time, and it's been a while, and people have started venturing out. Yeah, any other questions? Anyone else who would like to unmute your line and ask a question, please go ahead. Yeah, Praveen.
Hi, Achal.
Hello.
Thank you for that wonderful session. I think the impact would be great on everybody, because I could see 16 people had joined before, and I could still see 16 people online. This is the impact of your talk. I think you have given us information, data, and awareness all put together, and it was crisp, clear, and it was wonderful. And this is what we need at this point of time. I've had this question from the beginning, that what do you foresee in future, maybe 5 years down the lane or 10 years down the lane, for a COVID infected patient? Like, what are the health risk that is posed? Like, what do you think? Maybe after 5 or 10 years, I know there is no data as of now. It's just been 6 to 8 months. What do you think could happen? Just by looking at the statistics and by your own experience.
Okay, I did not want to talk about this just with the concern that it might lead to unprecedented level of panic. But yeah, science is science. You will have to deal with it eventually. The thing is, the aftermath
Yeah.
is not that encouraging. In a sense, I told in the middle about the damaging effects on the myocardium, the heart muscle. It is according to that particular paper. I mean, mind you, there are papers coming out every now and then, but that particular scientific study, the first one to bring a light on the data, the hardcore data, it predicts that next decade we'll be seeing more of heart attacks because the heart has taken damage because of this infection. Okay, and the longer you have waited before bringing down the infection and the complication rates, the more damage the heart has taken. Even if you have survived this time, there is a risk in the next decade. That's what they're saying. Okay, and let me quote this particular dilemma which people had in the very initial phase, early March, I guess, early March or mid March. A lot of cardiologists were seeing getting coronavirus, and they're succumbing to that. What was happening was that the cardiac patients, they themselves had coronavirus. Okay, so because of that, the heart attack used to be there. They used to go to a cardiologist. Cardiologists never even realized that they had coronavirus in them. He used to treat them without taking much precautions, and that's what led to more cases among cardiologists. So yes, cardiac related complications one, and second thing would be more amount of thrombotic related, the clog in the blood vessels. These are the cardiac related system, okay? Cardiac system related. Next, it has been seen that those people who come out of COVID-19, let's say they had a tough phase in the hospital, even if they come out, the recovery is not that simple. They do take some amount of time before they can breathe freely and do heavy work. It has been observed that in many cases, so especially in those cases where there was a delay in getting the admission done and they had to undergo ventilation, all those things. In fact, some reports say that those who undergo ventilation, there's a lot of damage to the lungs. So the point is, it's not over. I think so. Okay, the damage will be there to some extent. My only advice, I mean, I think I told Praveen only when he was talking to me, I told I will try my level best not to advise anybody, because we all think from our higher throne and we don't understand others' difficulties. I get it. But as a doctor, my one suggestion is, if you do get symptoms, at least before it becomes complicated, try to get some test done, try to get the corona test done, because only when there is corona positive, the further tests are done. Let's say X-ray or something like that, which will tell us whether you are on the path of complications. That's all.
True. Thank you on that.
Yeah, my pleasure.
Any other questions? Okay, I have a question, Dr. Achal. In references to all the different updates that we did go through, the slides that you have shared, a few things from a perspective of doctors or corona warriors, and you did mention about some of those practices or thing where people are still apprehensive whether to go to a doctor or not at this point of time, considering the cost of medication and different reasons that you did mention about. This particular situation has put in a situation wherein, even if it is true or should be believed true, it's really annoying to see some people making more merry out of the situation than coming out of the humanity side of it, which has been widely observed. Though yes, there is humanity that is existing. We have seen a lot of cases. I mean, 90 cases against 100 cases, than those 10 cases, which definitely puts a wrong thing in the mind of people when they see such kind of situations happening. One could be a doctor going in and coming out, and the cost of consumables or medical consumables not getting into the insurance cost, and the medication cost being in hundreds and the consumables being in thousands or lakhs, has put a psychological fear in the mind of people, whether should I go about it or not. And the other side of it being, like you did mention, yeah, a homely Medicare or a thing can definitely be equivalent to that, to restrain yourself and to get back to better health. Your take on it?
Uh, I cannot mince words in this. I have heard so many instances that they have been charged exorbitantly. Yes, yes. I'm not telling that it doesn't exist. But the thing is, this is a very, what do you call, close encounter, which I had very recently. One of my close relatives were admitted and they got discharged. Luckily, the cost was, yeah, I mean, was completely borne by the insurance company only. That I think was possible because they stuck to the caps set by the government. I think just 2 days back, government said that the plasma therapy, each session of plasma therapy should cost not more than 5,500 rupees. And I think the institution where my relatives were admitted, they stuck to that level, and whatever consumables, everything, every single penny was taken care of by the insurance company, because they had not overshot that. If the consumables, the limit is 5,000, and if you charge 10,000, then the insurance company says, I'm not going to do it. Okay, so that it depends on whether you have faith in certain institutions, and you'll have to go with that. It's a tough call, I get it, but it shouldn't prevent people from taking proper care. That's a tragedy.
Yeah, thank you. Just going with that a little more, couple of instances. There have been some instances that I have seen a few doctors do making videos from their hospitals, mentioning I have beds, I have all the facilities available, but however there has been reluctance by the other fellow doctors to go about taking or calling out patients, or they going to that location to go about treatment. Anything likewise? I mean, is there something stopping from doctors to also go to other institutions and treat, or is it only that they are within their boundaries that they should operate with? I'm asking it in general. I mean, I have no offense about any individual as such, because we respect all the doctors who have been on the front line for sure. But these different instances also go about showing in terms of a community spread when they talk, and the kind of word community has been used very differently. So with due respect, no disrespect to any community or thing here, but that word community has its own influence on people and their psyche.
Yeah, if I understood your question, you were asking whether there should be any restriction to certain hospitals as to why certain people are not referring the cases to certain hospitals. That is the question, right?
Yeah, possible. More like, for example, if it's a community hospital and only it's restricted to that community people to go and take Medicare, or any community people are welcome, because hospital is supposed to be treating any without any caste, creed, discrimination, or kind of a thing. But uh, some instances have also showed people taking reluctance to go to a different community hospital, as well as doctors also restricting themselves not to go to that kind of hospital.
It's a tragedy because you cannot restrict. It's completely wrong. You cannot do that, where you say that this particular community people cannot come. I mean, just to give an example, I'm not going to mention the states, but the states started putting the borders also. Okay, forget about the international travel. The states started putting the borders also, telling that we are not going to treat your patients. I mean, patients do need healthcare, and they will have to go to the hospitals. You cannot stop that. That is one. Second, it would be totally unreasonable to have the fear that if that particular person comes and I am gonna get because of that person, and that's why he should not come or I should not go to that particular hospital. I mean, if the protocols are followed properly, this sort of fear should not be there in the first place. It doesn't make sense. Yeah,
True,
that's
I agree. Yeah, I mean that was the thing. I mean, I understand it. That's the need of the hour, like you mentioned. Yeah, being a border between two states or two places, and someone wanting to go to that particular thing, if that is being blocked out, the very effective medication to be given to such people would definitely stop them from taking such benefits.
yeah.
Okay. Any other questions? Anyone wants to unmute your line? Please do so. Vijay Bhagava sir, if you are there, should you have any questions?
No, actually, I have absolutely no questions because the talk was so nice and so informative, with totally professional and full of data and reality. So, one thing which strikes very hard is the kind of apathy and the kind of with, and also the lack of discipline, lack of understanding the situation, and then being responsible from our side. So that is what is missing in our society, because all other problems were existing all the time. So this is the time when we have, as a community, as a society, should come together and then collective fight together, not by breaking various rules or taking things easy, and also showing bravery, or as though they are immune, or nothing can affect them, or they cannot forego certain things in life. So this kind of attitude should change. I really appreciate, and from the bottom of my heart, thank all the people who are into providing healthcare and treatment, and attending to the needs of the population, and they are doing wonderful service. Of course, the exceptions are always there everywhere, so no exception. Despite all the exceptions, which is a very, very negligible number, but I think very soon we'll come out of this, and it will be very nice for our country as a nation to learn a lesson from this and then start a new life, new chapter altogether. Thank you very much for arranging this talk show. I thank you, Dr. Achal Shetty. You gave a wonderful talk, and I have no
Thank you.
words to
Thank you.
praise you.
Thank you.
Any other question? Should you want to unmute your line and share your comments or appreciation, feel free.
Hey Achal, thanks for accepting the invitation, man. So
Thank you for providing me this opportunity.
no, it was a wonderful session, Achal. Thanks a lot. So I've been asking questions to Achal for many days. So he'll be so simple to answer all the questions with all the patience also. Thanks a lot.
Yeah, thank you, thank you.
Any other questions?
I think
Can
Sunil
ask.
wants raising his hand again. So Sunil, yeah, you can unmute your line and
I was clapping for him, not.
okay. Okay, it showed a hi. Okay, thank you. Prasanna, yeah.
Dr. Achal sir, thank you very much. It was very informative. It's a lot of data. Thank you very much. So hope everything will be good in for next sessions. Next season will be better for all in our country. I request everyone to come on the your camera. We'll take one snap of this session and we'll take a
Selfie time.
call on this.
Right.
Yeah.
Just in the meantime, I would also request everyone for your prayers for all the doctors who strive their best to make better of the situation of Dr. S.P. Balasubramaniam, but we lost him. And many more people from the entertainment industry, we've lost them during this pandemic. And again, it's sad that some of the good people are no longer with us, but we hope that we come out of this situation as soon as possible and see more better times, and let's celebrate their lives for sure, and go about in a much better way, and bring back the humanity in every one of us. Yeah, thank you. Let's come on the video and get for a small picture of group that we have participated today.
I request everyone to come on video, please.
Santosh, Kirti, Suma, if you can please turn on your cameras. Sandesh.
Thank you, Achal. For these conditions, it's like, I don't know, as you mentioned in your slide, like a lot of anxiety and a lot of mental pressure is happening. We don't know, like even every condition, because of like a lot of people have planned, dreamed, a lot of things just step back. And we like even we like I get a lot of calls from my friends that they're also in trouble. All this like listening on the all, it feels very bad. Yeah, hope all will come out of very soon, and definitely we'll follow like after understanding your session, the social distancing and having the proper mask, all this prevention methods will definitely help all of us. So I'm just taking a print screenshots and I'm posting in WhatsApp. So I request you'll, I mean, I hope you'll get all these images from Ashok Kumar. Yeah, thank you.
Thank you, thank you.
This been in our classroom sessions. Yeah, it could have been a selfie time with Salim. It was what called as earlier. Yeah, it's now more of a print screen with Salim. All right. Thank you very much. Yeah, we went past.
Thanks for this session. Yeah.
Thank you.
Thank you, everybody. Thank you. Thank you.
Yeah. All right. Thank you very much for staying all the way. And like Praveen did mention, yes, even if it's 6:51, we've all been glued to our screens for this informative session. Thank you. It was wonderful and a lot of insights, as others pointed out. Wonderful to have you, and hope we get to see some more positive slides from yours next time when we happen to come and get along with you, and some more positive communications in reference to the stage 2 moving to stage 3 or stage 4 and widely available at a affordable cost, though we say that medical costs are increasing, but we make sure, at least we hope that it's affordable and people get back to much better health in the days to come. Thank you, Dr. Achal Shetty, and thank you all for joining us this evening, and have a wonderful evening and a happy weekend.
Yeah.
And we look forward to seeing you again in the month of October. Thank you and have a great day.
Thank you. Thank you.
Bye.
Take care all.
Take care.
Stay healthy, stay happy.
Yeah, sure.
Akhilesh, we can close the session.
Yeah.